recap from Pip from the last meeting, and then we're going to do introductions and updates. So just a bit of a heads up on that. One of the main things that we're wanting to know, as well as kind of taking a temperature gauge from each of you, is kind of whether or not the key kind of winter planning messages are getting through to your communities of interest. So the importance of accessing the flu jab, and that non-COVID related health services are still open, like GPs and specialists and that kind of thing, and whether or not people know that they kind of still use A&E, but it's got to be done appropriately. And then we're going to have a guest speaker, which is going to be Karen and Mirov, and then a bit of a group discussion around their kind of mental health reflection. And then there's some key messages from Anna from Healthwatch and from Pip. And then there's a bit of an update from Pip as well about the third sector outbreak plan. And then looking at setting next meeting's agenda, and then any other business. So I think that's over to you, Pip, for the summary from last meeting.
Oh, thank you. Yeah, so if I do that, and then Daisy might just give a quick overview about the weekly email. But it seems so long ago, the 8th of September. Hasn't the world shifted again? It's so much since then. But anyway, last time we were particularly concerned about raising rates and the whole issue around sort of myth busting, but also people's genuine concerns about all sorts of information, and increased anxiety and issues around testing, work with young people and the increased numbers of young people presenting, and schools going back was a big issue at that point. Huge issue around social isolation, particularly older people, and concern at that point about, because that was when people were sort of coming out of lockdown, and older people or people who'd had additional kind of health clinical vulnerabilities were concerned about what that would mean if they were no longer formally shielding, and then particular issues that we raised around track and trace and the app, which we'd kind of shared, and which I know you'd all shared information about. We, particularly around the app, we raised some of the concerns that people had, not just about access. There were particular issues around access to the app, and for people with sensory and other impairments, some of the sort of challenges of things like an app and the whole link obviously with digital. But there was also some very real, and continue to be some very real, concerns that people have about that whole track and trace and what that means in communities. So we made sure to feed those back up through Tom Reardon, who in turn has made a commitment to feed that up nationally. So we are where we are, that we obviously trying to do what we can to get information, and continuing as ever to get good, clear information out to people, but also raising concerns and issues from all of the communities that you work with about what that actually means and feels like on the ground for people, which, you know, we know the complexities of all of that. So in terms of an update, we know loads has changed. We've had a real focus on information, particularly around young people, and I'll come on to it in the update around the outbreak plan and social isolation. So yeah, I think in terms of specific impact, I think, yeah, we continue to raise issues and to see how much that's valued. And I've just this morning been on a call, there's this sort of weekly call that Victoria Eaton chairs, and just that huge thanks to you all from her directly about the work that you're doing, and about how the way that working together as a city and trying to do what we can to work together and to make sure that we're all in this together, and that people aren't just being told things, that we're hearing back from people and communities and taking people with us, you know, is the thing that will, if nothing else, will help us at these difficult times, because we know it feels like a really difficult time ahead for people. I don't know if there's anything to add, Daisy, from the weekly email specifically.
Yeah, so hi everybody, those who've not met and haven't been before. I'm the member support worker at Forum Central, so I send out an email every week with sort of updates about these meetings, but also sort of key information and things that we hopefully are useful for you to know. So you should all have got that, but yeah, let me know if not. So this week there's an update on the local testing site that's been set up for key workers, so we haven't put that out widely. Obviously demand is quite high, and it's specifically for frontline workers, but yeah, hopefully that's useful. And we've sort of put out via our website that anyone can get in touch if they need sort of help to get information for that. And there's some update on the flu, which is obviously a very timely and a big challenge that's coming up, so around vaccination and who's eligible for the free vaccine. And yeah, Pip might say more about that. And then we had Sam from the IOPC, the Independent Office for Police Conduct, at a meeting a few weeks ago, it's probably about a month ago. So he's just followed up with some information that's hopefully useful in relation to what he had brought to the group. And that's everything.
Cool. So I'm going to mix things up slightly. I know we usually go in alphabetical order, but I've seen what a logistical challenge that is for Pip. And I know a couple of people are eating their lunch, so I'll leave them to the end. But just to start off with, I haven't got the name of the person who's called Voluntary Action Leads 2. Apologies, really bad with names, but I'm going around my screen. So are you okay to just give us a kind of brief introduction of what you do and a bit of a kind of temperature gauge and update from your community of interest or service?
So, hello everyone. I am Voluntary Action Leads 2, also known as Anne from Young Lives Leeds. As Pip sort of alluded to, there's been quite a lot of work going on with organisations sort of based in the 4 wards where there's been the highest sort of rate of infection, to bring together organisations to get their views on how things could be done differently and how the messages could land with the young people. So there were 2 very successful webinars. One was on Monday afternoon and one was last night. And we're just in the process of pulling together information that will go out to those groups and some funding that's available as part of the outbreak plan to help organisations do things either quite quickly to get the message out to young people. So that's been the focus of my time. Some of the conversations I've had, people were getting ready for lockdown easing and getting back to being able to do some face-to-face sessions, and now things are changing. So it's what will that look like and how long will that sort of situation be in place, but we're monitoring that. So I think those are the key things, Owen.
Okay, brilliant. Yeah, and it sounds like the stuff you're doing is going to be educating people about those kind of window planning messages around kind of flu jabs and that kind of thing. But there's some information I'm sure coming up later that might be useful. So next on my screen is Charis. Or is it Caris?
It is indeed. Hi. Everybody says it's fine until they see it written down, and then it changes. But I'm Caris Green from Leeds Society for Deaf and Blind People. I think just in terms of challenges for us, and it's been an ongoing thing, but it's very difficult to reach the community that we work with, because historically a lot of the community have been in the centre where we are, and there's been that kind of close interaction, which at the minute isn't the case for obvious reasons. And I think what we're finding is that, you know, there are still some very clear challenges with communication for both community groups really, but digital isn't the easiest adaptation for somebody with a sensory impairment. In terms of the messages, the key messages that were mentioned, I've actually asked our acting chairman to do a video in BSL with kind of summarising of those messages. just because one of the things we've identified is it's great to share things on Facebook, but not everybody accesses that, not everybody accesses the social media channels. But what seems to be happening quite a lot across the deaf community particularly is people are sending videos to each other through WhatsApp and things like that. So what I'm trying to do is test out this idea of a quick video that can then be sort of shared out to friends and forwarded on, so that it gives a different level of reach to just sharing the messages through Facebook. So it's still a challenge, and it's still kind of one of the things that's ongoing, but I'm looking at us trying that. The other challenges that we are still finding in some cases is that when messages are coming out, there's often a kind of caveat of, if you need help and you haven't got anyone, call us. That's not possible for a BSL user, and there's not often that alternative on there, and it does cause frustration from the community. So some of the previous kind of, be it flyers or whatever that have been shared, have very much had, you know, phone this number if you need help and whatever, and it is seen as a bit of a frustration from some members of the community. So we're happy to sort of say contact us, but it would be ideal if, I know particularly these messages, if you don't have a friend or family member around, you know, if there was an alternative there that could be highlighted, or indeed if, you know, if there's some support that we can provide, then it'd be great, just so that when those messages are going out, they're accessible for everybody, not just the people that can pick up the phone and ring. And I think that's kind of the key things for us. The other thing that I'm trying to do as well is establish some more kind of key personalities within the community that, again, we can gain more feedback from. We're very fortunate in that a lot of our trustees sit within the community groups, and therefore we can ask them for feedback, but I'm just still got ongoing concern that we're not reaching everybody. And I don't know if we'll fix that, but as long as we're trying and doing, you know, being as creative as we can, I think that's the key thing. So that's my update. Thank you.
Yeah. It's something we've kind of identified this week about the videos as well, and especially around kind of accessing some of the testing services, that maybe a kind of like a video of telling people how that might work would allay a lot of fears as well. So Toshal, I'll warn you, Shaq, you're after Toshal. I'll give people at least a couple of minutes warning.
Hi, I'm Toshal from Health for All. This is my first time joining this meeting. I was speaking to Carl just earlier in the week, and we were sort of discussing, because of our work with the BME seniors and quite a few community groups that we work in South and East Leeds, and wider community. So yeah, that's why I'm here. And in terms of the sort of feeling from the community or the groups, I guess it's probably similar in terms of mixed messages, some frustration. We were doing leafleting yesterday and got, you know, quite a sort of different feedback from local people regards to, you know, why are we being given this leaflet when we know about this? It's 6 months down. So it's I think it was different when it was in March earlier on. I think people now want to know, what can I do safely? Can I do this? Can I do, you know, am I allowed to do this, or is this safe enough? And kind of wanting to come back to some form of normality. That's another sort of feeling from quite a few sort of older people who felt that shielding ended, but they've not had activities to go back to. So especially older BME you know, members have raised that again and again. Again, with the IT, they are not brilliant. So having things online, having messages online, that's not been a great sort of way to get to them. But yeah, it's sort of generally what sort of the strong feeling is.
It's really interesting to hear the reaction you get when you kind of doorstepping or leafleting, and how different that is. Yeah, because I know a lot of organisations have struggled with that. So, Shaq, over to you. Thanks for the link. Should have known about that, but that's really useful.
So hello, my name is Shaq, and I'm really pleased to be here, and I'm really pleased to meet everyone, really, albeit virtually in these slightly strange times. Just in case you don't know who I am, I'm the communications manager for NHS Leeds Clinical Commissioning Group. I don't know if anybody wants to know what a clinical commissioning group does, or if I can save 5 minutes of your time and move on from that. If you want to know, let me know. I'm happy to quickly. So I'll do it in 30 seconds. Basically, NHS generally split into two parts. One side is known as commissioning. One is providers. So providers provide services. Commissioning, in a nutshell, hold a budget and prepare the plans and the strategies for the delivery of the majority of local services. Some of them are commissioned nationally, but in a very, very quick nutshell, that's essentially what we do. But I could easily talk about this for a very long time, and I'd still be none the wiser, and neither will you. My work clearly in the last 6 months has changed quite dramatically to pretty much being about COVID and COVID-related issues. And I've been working closely with Pip and Daisy, and I want to thank them, but also thank everyone else, because through Pip and Daisy, we get your feedback on issues around access to services and also getting messages out there. So if you're not aware, we have got a number of resources we've developed, and Carrie's picking up on your point earlier. So for example, accessing services, we've got videos in BSL format, and as well as different languages. So if you haven't seen them, I'm happy to share the links. I'm pretty certain Daisy might have done it, but I'm happy to have them recirculated if that helps. And one of my colleagues, Chris Bridle, is going to be working closely with Iona and Pip and colleagues around some of the winter messaging this year, because we're obviously there's no denying this year is going to be really tricky for not just the health service, but everyone. I mean, let's be honest, our community is going to have a really difficult time. It goes without saying. So what we're trying to do is provide reassuring messages, but also trying to manage expectations. So we do have a bit of a backlog in terms of people who might have been waiting for treatment. So if it's something called planned care, which is, I'm going to use an example, but don't use that as the sole example, but things like knee operations. So really important to that individual and their quality of life, but compared to somebody who's been rushed in due to a car accident and needs to be seen immediately, and obviously COVID patients, clinically that might not be seen as urgent. So I don't want to sound dismissive of somebody needing a procedure, but there's an element of we have to assess clinical urgency. The fact that our spaces have to be COVID secure, that means we've had to reduce the number of beds to ensure there's enough social distancing. Our own staff will sadly have to self-isolate occasionally. So again, we got a reduction in staff numbers. So it just means that there will be some further delays for people accessing care. And it's a really important message in terms of managing expectations and where it is appropriate, how you can maybe look after yourself at home. The other challenge clearly is around the mental health impacts and how we can, again, promote services where they're needed, self-care where it might be better. And then thirdly, how do you make sure you use the right service? And I think you've covered flu and all the other things that will help protect you and the NHS this year. And the other sort of concern is that when people assume, because the local media and the national media are using the word lockdown when it's actually restrictions, not lockdown, there might be a bit of confusion. People might assume, they wrongly assumed everything closed before, which wasn't the case. It was certain parts of the NHS had to reduce or suspend services, but GP practices were open throughout, albeit the initial appointment was over the telephone or video, and then face to face if appropriate. What we don't want is people to make that wrong assumption that we're closing. So it's really important that A, we're still open, and B, if you've been asked to attend an appointment, you must do so. So we've got a number of resources that we've either developed or are developing, and as much as possible we're trying to do that in different formats. But I also want to flag up some other bits, if that's okay, and also ask for your support beyond that. So first one was work with younger people. We've just developed some new hand washing materials which have been shared previously, but I've got, and it'll help with domestic domestic issues at home if I can hopefully distribute some of these posters. Otherwise, my wife will ask why I'm literally bringing work home, including posters as well. But I've got messages about hand washing, but they're targeting a younger audience, and one of them is particularly for the South Asian community. So as an example, the message will say, you picked your nose on a Zoom and you were on a Zoom call. Some things you can't wash away, but for COVID-19, there's soap and water to reduce the risk of virus. So it's very much designed to create a bit of an emotional connection in terms of humour rather than some of the other messaging that we see out there. And I've got window stickers. If anybody wants any, feel free to get in touch. And then earlier this week, we held a Facebook Live event, which is around coronavirus myths and misinformation. That's the recording of that's still available on our Facebook page. So if anybody wants to direct people to there, it's facebook.com/NHS Leeds. The actual full recording is an hour and a half, just to warn you, but 40 minutes roughly presentation, and then all the questions that came in. Clearly, we didn't answer all of them because there were certain people with certain agendas that we weren't going to air those kind of myths. We just didn't feel it was appropriate. And then we'll talk about WhatsApp messages. A bit frustrating, but we wanted to set up a WhatsApp broadcast channel and do it officially and go through the official channels through Facebook. But Facebook have now got a new policy that prevents government organisations from having a broadcast channel. But as Carrie said earlier, it's the way people are communicating. So there's this idea around digital exclusion. But I know that a number of people who theoretically would be classified as being digitally excluded actually really understand how to use WhatsApp. I mean, my mum being a great example. I mean, if I asked her to order something from Amazon, she'd never be able to do it. But you know, she can connect with us quite easily on WhatsApp. But yeah, unfortunately, they've said no. And I think we're looking at a potential myth busting campaign working with the council. But we've seen something that Bradford have done, and it looks really good, if I'm honest. So my view is whether or not we either plagiarise what's on there and then localise it to Leeds. So I suppose the request back out is if there's any particular myths that you think are circulating and should be debunked, because I don't think we're going to go down the route of talking about 5G maths and all that, because I don't think that's appropriate. But if there's more appropriate myths that you think we should cover, that'd be really helpful insight from communities.
Cool.
I'm sorry to take.
It's all right. I'll have to stop you there, Shaq, because we've got 15 more people or 13 more people, and so sorry, Sophie, you're next. If we can keep it to kind of under 2 minutes, but that was all really, really useful, Shaq, and I'm sure it'll be disseminated throughout the communities of interest. So Sophie.
Yeah, I'll keep it really brief, guys. So I'm the Youth and Health Project Coordinator, but I also look after the neighbourhood networks over 55 groups as well. So in terms of our health side, the patient ambassadors who are based in the doctor's surgeries across East and South have been supporting people to access things like their flu jabs, because their vaccinations obviously is one of the NHS priorities. One of our patient ambassadors attended a day at South Bank Surgery, like a vaccination day, and supported, I think they had over like 200 or 300 over 65s going for their flu vaccination. So that was like a really successful day for them. And then in terms of our group sessions, same as pretty much what everyone's feeling at the minute, that we've kind of obviously had to limit the group sizes. We're trying to find ways that we can still have like our walking groups, gardening groups running, just more PPE, more cleaning, bookable slots, so it's within the guidelines of no more than 5 people, etc. And we're looking into things that we can do off-site, because currently we have 2 sites, but they're both operating as food banks. So at one point we would have had space to run our groups in a socially distanced way, but it's obviously something we can't do now. So looking at things like gazebos that we can set up in the local park, get young people to come down and have like a hot chocolate, and like they can have like any kind of one-to-one IAG there, and then like plug in these messages of keeping safe, letting them know what they can and can't do, letting them know what options are available to them for support, etc. So yeah, just I guess same as everyone, really trying to just balance and find new ways of working.
Yeah, it's a challenge, isn't it? Mirov, I don't know if you're going to give an update. No. So Rachel, and then it'll be Amber.
Hi, so I'm from Carers Leeds, and yeah, feeling on the ground for carers, already stretched family carers are now facing continued isolation and minimal opportunity for respite. This is due to either services that have been stopped or paused, but also because of like the further restrictions that they're under now. They can't rely on friends and family. So we are hearing now that more so, not just now, but we have been throughout, but the carers really are reaching that breaking point, both physically and mentally. We've noted an increase in our emotional welfare calls, also our bereavement support, and our health project is getting more and more popular as well. The need is definitely there. So our key messages really are just identify massively, because all the strategies that are based on carers was for 72,000. It's massively increased since then. So we need to help people identify themselves as carers, acknowledge them as carers and support them. So I'll keep it brief, but that is, I don't want to go on too much, it's pretty dire. But the support's out there. You all know to reach out to carers, so that just makes me feel much happier.
Cool. So Amber, and then Ali. Sorry, you're on mute.
Yeah, here we are. So basically, yeah, we know that the restrictions are a bit more limited, but we hadn't gone as wide with the kind of relaxation as we had. So we're kind of continuing in our risk assessment face-to-face meetings where we need to, where we don't have to. It's based on an individual assessment. So that's for our young people's as well as our women's work. So that means that we are visiting people in the home where we need to, but if we can do it somewhere else, we will. There's no group activities though still, but we are continuing with face-to-face wherever, primarily because we've also noticed, as the previous speaker said, about the real impact on mental health of isolation and that feeling of not being able to connect in terms of other coping strategies that people are using. Substance abuse is going up, and there's just, I mean, maybe we'll come to that when we talk about mental health, but really that lack of access to crisis support, particularly for people that are under the influence, which is often the case for us, and there doesn't feel like there's always a place to go for them. We are open. I just want to highlight, if anybody is worried now that young people are slightly more visible in schools, I suppose, if anybody's worried about young people that might be exploited in any way, we are open for referrals. I'll take a keen look at those humorous messages, Jack, to see what we can do about spreading them around our young people's service as well. That'll be good. We've had, if anybody is working with women that we also support, we do have a few specific tests, COVID tests in our office for women that are likely to be very reluctant to engage in that process. So if we think that a woman is symptomatic, we will try and convince her to get a test, but we probably wouldn't say go to a walk-in centre, because it's very unlikely that that will happen. So we have a small selection of tests that we go and we process it for them to make sure it gets done, the information is there, and we can also help them, support them if the test was positive. So in case there's any overlap with some of the organisations here, please let us know. We can help facilitate that. That's it.
Cool. Yeah. Really interesting about that post-COVID test or COVID support, like emotional support. So Ali, and then it'll be Iona.
Oh, hi. I'm Ali from Leeds Older People's Forum. I work with the Neighbourhood Networks. I think the Neighbourhood Networks are coping with the imposition of the restrictions announced last week. And are reporting feelings of despondency and worries about mental health among some of the older people they work with, particularly their more vulnerable members, those living on their own and those who can't get out. They've also reported this week that older people are very reluctant to use pubs and cafes because they don't necessarily trust that other members of the public are adhering to guidelines, and also some are very wary of using public spaces. And so effectively many are living in enforced lockdown. The restrictions have also had an impact on services that the neighbourhood networks were beginning to roll out or thinking of rolling out. And there's been some hesitancy about, amongst many of them, not all, but amongst many, of moving back to socially distanced activities. Although they know there are special exemptions for charities, and Older People's Commissioning have provided them with their interpretation of the guidance. But people are very concerned about older people's well-being over the coming few months, and are looking at activities that will induce happiness and provide an uplift over the coming months. I think the neighbourhood networks themselves were feeling quite down about the most recent restrictions. So that's, I think, pretty much the neighbourhood networks. People are waiting to hear about the winter grants funding that's been distributed by Leeds Community Foundation. On another note, not related to older people, is that Leeds Older People's Forum, in partnership with Volition and Forum Central, recently won a National Lottery Community Coronavirus Community Fund bid to deliver services to men at risk across Leeds during this period. So there'll be more of that announced as the projects get started.
Cool, thanks for that. So Iona, and then it'll be Jay. And Damien, I'll leave you to last because you're driving. It's kind of like an action scene there going on. Like.
I'm not driving, I hasten to add.
Oh, you're not? Oh.
No, I'm being driven like Lady Penelope.
Very posh. So Iona.
Yeah, thank you. Hi everyone. So I'm from Voluntary Action Leeds Voices. We don't represent any groups as such, but I'm here to well, add to what Shaq was saying about the winter messages. So we're going to be working with some of our Engaging Voices partners, and some of whom are here, I know, about ensuring that the winter messages going out are best fit the communities that they're going out to. And our specialism, I guess, is working sort of in depth with groups to make sure that, so I'm thinking of you, Charis, of the, you know, what you're wanting, and to ensure that all of the service users are actually having, you know, get the messages and understand them and act on them, to work in focus groups, to explore those messages and develop them. So I'll put my email in the chat, but we will be in touch with people, all the partners that we have, and I think you know who you are. There's quite a tight turnaround, so we've got this month to do this. I mean, winter's around the corner anyways, but anyways, it's at the front of people's minds, so hopefully it will be, you know, good to do. And of course, we are able to offer incentives to partners for this, so it's just an extra little bit to help out as well. So I think that's me done.
Sounds good. So Jay, and then Charlotte after Jay.
Hi, yeah, I'm Secretary for Leeds Faith Forum. Very short update. Basically, the new guidance that's come out has caused wondrous amounts of confusion amongst faith organisations in terms of what they are and aren't allowed to do at places of worship. So confusion over whether people can actually attend more than 6 or not more than 6, and then the actual fact is it's all around socialising either before a service or after a service, and people are now getting to the point, well, some places of worship are getting to the point where they're now looking at putting on either 2 or 3 services in a day because they have that much or that many people wanting to attend, so it's causing some organisational confusion, but they're getting there. And that's about it.
Oh, cool. That was snappy. So Charlotte, and then it's messed around with my screen. Annette.
So I'm Charlotte from, I'm health coordinator at Leeds Gypsy and Traveller Exchange. So a bit like Jay's just said, things seem to be up in the air at the minute with the new local restrictions. So before that, we were looking at getting members more engaged in some little small activities, organising small activities, trying to get members engaged, because we did see a lack of engagement. Obviously, people feeling like lockdown was lasting forever, and just trying to keep up good relationships with our members. We've also still been carrying out our welfare calls. These are for members that we feel are digitally excluded or may not have access to social media or WhatsApp. We've been carrying out them weekly. Most of the members on the welfare call list we identified at the beginning of lockdown as our most vulnerable people. So we've been continuing to call them weekly, updating them on the guidelines, just trying to make them really clear so people are understanding what they are. Carrying out weekly meetings amongst the team, just to make sure that we're all on the same page and we all understand what the guidelines are. Just to make our members, especially the vulnerable ones, feel like they're supported and up to date on these guidelines, who were really excluded from Facebook and WhatsApp. We've obviously been using Facebook as one of our main platforms for sharing information on the guidelines, making short videos. We get really good response from really short videos, so just making them really snappy with some of the really key information on there, instead of making them confusing. We've been doing that all throughout lockdown. We've been WhatsApping them around, so we've been getting a lot of good feedback from them, and a lot of members saying that they're watching them and how useful they are. We've also been using the Facebook to obviously try and get members engaged in some sort of activities. We've been partnering up with One New Leeds and Forward Leeds to get members involved in some other stuff that might improve their health. So trying to continue with our work the best we can by using different services and trying to get people onto Zoom and stuff who can. We've been really trying to focus on that, because we feel like the quicker we can do that, the better. Having in mind that we might be going back down into local lockdowns. So really trying to upskill members moving forward so that they can continue to engage with us the best way that they can. We've also been continuing to support our roadside members. We've got around 90 families roadside. We have managed to do some outreach, only once throughout, but we're looking at that again since we've had some local restrictions put in place. But it were a good experience to see our members face to face again, which obviously we see as key to keeping up good relationship with members. Handing out some easy read flyers, just having general talks and chats, just letting people know that we're here, informing people on the track and trace, informing people on where to get tested, if they need any more information on that, and also just trying to keep members motivated and thinking forward. Obviously we've seen a lot of members feeling disheartened, or you could say a bit fed up due to the lockdown, so we're just continuing to try and keeping members engaged with Leeds Gate, and keeping up the good relationships, so that continuing to move forward, we don't lose, our contact with members. So that's been something that we've kept in mind. Also, at the minute, obviously with the local restrictions, we have sent out quite a few videos, just explaining what they are, because like I say, a lot of people thinking it's a lockdown, but it's actually not. It's just some further restrictions put in place, trying to make sure that members know what the guidelines are. And we've also been doing some myth busting around returning to school, which was something that was really up in the air with members and really confused. So we've sent out some videos, but that seems to have calmed down a lot now, seeing as people have gone back, seeing as the kids have gone back to school, we've seen members feel a little bit more calm about it. I think it was just the build up towards going to school. So thankfully, a lot of members that have returned the children to school, they do seem at a little bit more of at ease now the kids are back in school. We've been trying to, obviously, like I say, focus on the digital inclusion, and that's something that we're really keen to keep moving forward with, as lockdown, local restrictions are back in place, making sure that members are digitally included and helping them the best way they can. And I think that's about it, really. A few other things that we've been doing.
Cool, thanks, Charlotte. Yeah, it's interesting to hear about the video logs things you're doing and how they're kind of reaching people.
Yeah.
So I've lost myself. And then Wendy, and I guess I know you're going to kind of give us an update later anyway, hopefully with the digital inclusion stuff. So I'll leave you off for now. Yeah, cool.
Okay, well, I'll be very quick. Annette from Voluntary Action Leeds, and I lead on the BME Hub. We don't deliver services, but we encourage people to have a voice. So we've been encouraging our members to get involved in some of the discussions that are happening around some of the Black Lives Matter agenda. So with the council and the Black Lives Matter core group that started 7 work streams around 7 key areas that were raised by individuals from the communities, different communities. So that's work that's going on. We're also in talks with various different agencies, including the NHS and various others, that we're working through different issues to address some of the inequalities that are within that. So I won't carry on too long, but that's ongoing work and it's going to continue. So I'll probably update more and more as time goes on.
Cool, thanks. So Wendy, and then Damien, and then me finally.
Yeah, we're obviously advocates. AVNet provide all the advocacy provision for Leeds. We see lots of different vulnerable groups. They're still providing that, including face-to-face when needed. A lot more mental health referrals, a lot more referrals around housing, learning disability services and some of our other services. We've got quite a lot of additional funding during this period, and they're doing a lot of digital and employment work. Learning disability services are reopening in smaller bubbles. We're seeing the same as in other areas, with people with learning disabilities of not accessing health services, coming to services quite late in the day, so not getting that preventative support, a lot of isolation, a lot of increased mental health. Owen will talk about the autism service. We're really wanting to work on the self-advocacy support to help people to access services in a way that suits them. So we're running an event on the 28th of October, 10 till 12:30, where we'll look at all those different options for self-advocacy resources, for self-advocacy groups, for peer advocacy, and look at how we can support community groups to develop those in their own settings. So we'll send on information later more about that.
Cool, thanks Wendy. I've got it primed, that link for the self-advocacy resources as well, but I'll talk about that when I do my update. So Damien. Oh, thank God. I thought you'd gone to Tracy Island or something.
Oh, sorry. Hello, sorry, I did just lose you. I was literally just walking in through my door then.
Okay.
Sorry. Right, sorry. Okay, hiya. Hold on a second. Literally just landed. Sorry.
I'll do me, and then we'll come to you, Damien.
Oh, thank you. Brilliant. Thank you.
Yeah. So I just really wanted, the really, really big theme that's come through over the past week or two is kind of what Rachel was saying about kind of the pressure on carers and the kind of, there was a bit of relief is coming. We've had quite a lot of people who are kind of in crisis mode and really struggling to get timely services to help them with that. And I guess the kind of big ask I would give to any commissioners or anything like that is to look at respite, because I think as much as you can support people and give them resources within their own homes, you know, and give them that mental well-being support, which is really useful, it's kind of coming apparent that actually people just need a physical break from people that they're caring for, and that goes for kind of younger people and people you know, kind of in the autistic population, tend to maybe leave home up to about 10 years later than might usually be the case. So I know from kind of the carers we've heard from, yeah, they're really struggling with that aspect of things. I think everyone's kind of covered the things that I was going to talk about in terms of the kind of video stuff and everything else. But I just, yeah, wanted to use this opportunity to really push that message home, because it has come up when we are dealing with people in real distress who are kind of reaching out to us and they've already tried other services, and it's difficult for us to help because we're not a crisis service per se, although we do deal with lots of people in crisis. So yeah, I'll pass on to Damien.
Oh yeah, thank you. Hi, right. Yeah, sorry I'm late. I just wanted to, I thought it might be useful just to give a bit more of an update following some research on COVID that I managed to, that I was sent. And I know I talk a lot about speaking on behalf of men in the city and how COVID's affecting them. I talk a lot about how, you know, we all know about males having a higher death rate, and it's worse if you're in a deprived area for everyone, and men from BME backgrounds disproportionately affected. There's also evidence that there's been an increase in mental health issues, drug and alcohol use, relationship breakdowns with children as well as partners, and domestic violence incidents, both as perpetrator and as victim. And I just wanted to just quickly go over some of the reasons why for that, just briefly. Being that men are more likely to engage in unhealthy behaviours like smoking and not seeking help and so forth. There are the differences in the immunological differences, which I mentioned last time, which I won't go into now. It's to do with the ACE2 receptor, but I'm happy to send on any information about that if you wish. They're less likely to follow government advice, with only 10% saying that the advice is, with 10% saying that the government advice is false compared to 82% women. And men are more likely to externalise their difficulties, and the opportunities for doing this have now become much more limited. For example, being able to get out and the availability of competitive sports. And so in terms of impact, we're looking at the physical, mental effects of long-term COVID, job losses, rise in mental health issues, predicted rise in suicide, and the effects of separation as more men become widows, and due to the relationship breakdowns, separated from their families, with only 10% of main carers being male. And now the research has come out recently. The Global Action for Men's Health recommends that that this data they've had to really struggle hard to get, and there is a need for sex disaggregated data. In other words, looking at how being a male and being a female, taking that data when these cases come in, they need to start taking stats on the genders involved as well, and see how that intersects with age and race and things. Gender responsive actions and investment in organisations supporting men and boys. That's the macro, I suppose. And the micro, I happen to have a list of some of the activities that are going on for men in Leeds. Mainly, it's mainly in East Leeds, I have to say, but some of it is online, so it's open to anyone in Leeds and beyond. So yeah, that's my summary for now.
Cool. Thanks, Damien. So I believe we're now going over to Karen and Mirav to talk about mental health.
Thank you, Owen. how long do we have? Do we still have about 20 minutes?
I think so, yeah. I was just kind of discussing with Daisy about how much slack we had, because we've gone a bit over, but yeah, I think 20 minutes should be okay.
To be quite honest, I think what we really wanted to do was bring back to everybody all the insight that we've been gathering over the last couple of months, and just explain to you what we've been doing with it, and what we plan to do with it, and what it can influence, and really use this space as a time to reflect on whether what we've heard is accurate, and also get a bit more of a snapshot of what's up to date. But these weekly or 2 weekly meetings give us that on a regular basis anyway. So in terms of that discussion, we've probably captured quite a lot of that in the updates from people anyway. So hopefully we won't take up too much time with that. I'm going to share some slides if that's all right, just to keep me on track more than anything. So it's myself and Mirav that are presenting. I'll just give you the context, and then Mirav's been doing the work, sort of drilling down into what we've heard. So can everybody see that?
Yeah.
Okay, yeah, so over the last couple of months, we've been involved in discussions through my role with the commissioners for mental health, and also within public health, and we link in with the Mental Health Partnership Board. So thinking about all the work that's come through the Communities of Interest Network, and also we did some specific surveying of our members across specialisms just to find out what the mental health impact has been on a local level. So what we wanted to do was influence this piece of work that's happening across the city around mental health needs assessment. So Sarah Erskine from Public Health and Caroline Townsend from the CCG are sort of leading on bringing some of that together, and a report that's going to go to the Partnership Board in November. And what we were really aware of is that there's all this richness in the third sector and through the Communities of Interest Network that might not necessarily be picked up on within other data. So the stuff that we can find from numbers, so secondary care admissions, primary care data, information about pharmacies, prescriptions, and who's going to see the GP. But in addition to that, everything we know through the Communities of Interest Network and through our mental health organisations about what people are feeling, and just wanted to make sure that we had that opportunity to really feed in everything that we're hearing through here in that strategic way, to be able to influence some of the discussions around what emerging mental health needs are, and where the priority should be over the next few months. So the stuff that we're going to present now is everything we heard from yourselves and the surveys of the members between April and July 2020. So we just really wanted this opportunity to bring it back and just say, this is what you've told us, does this sound about right? And then get that flavour of anything more or anything updated that we need to keep an eye on. So obviously we're really short on time today, so just please, if you use the chat, that would be really helpful, because we can capture all of that as well. And so while Mirav's talking, you know, do actively use the chat to encourage, discourage, agree, and all those kind of things. And also, if we don't get a chance to get too much feedback in afterwards, then you know, I nearly said at the beginning, I've got a parcel coming, and it's come at exactly the time I hoped it wouldn't. My husband sent me a text to say it's coming about 1:30. I thought, great. So that's a good opportunity for me to pass over to Mirav so I can answer the door. Don't need that one.
So the information we have, so first of all, I'm Mirav, and I'm helping out a bit with mental health gathering of information, and a bit of work with Forum Central, and specifically with Karen. And whilst the information we had was not from tons of organizations in terms of volume, the themes were very repetitive, and they were also very much in line with some gathered themes around the national data that's coming out through mental health organizations. So I'm going to go through it all quite quickly. If you need anything to be explained more, then just let me know, stop me. So the first thing we've seen is the top, which are the top mental health issues that came out of those organizations that have replied. And the first one is social isolation and loneliness across the board. We have then abuse, domestic violence, tension and safeguarding, and these are again from families that have carers duties or somebody with a disability, and the tension that's creating around them being at home all the time, having no support, no respite, domestic violence and the ability or lack of ability to shout out and to report and then to reach those people that are in distress. So there's a lot of reporting around that. Suicide and depression. So whilst volume-wise, and those that have been in the meeting yesterday, I'm duplicating myself, but in terms of volume of need, so most organizations haven't had an increase in numbers, in need, in the demand. However, they do have more complex needs. So suicide is the third one that comes across alongside depression, and then anxiety, both around being in lockdown and also stepping out of lockdown. But a lot of the anxiety is related also to communication and no mention. Sorry, I won't be reading this. I think Karen will be reading the messages as they come up, because then I'm thrown off. And loss and post-trauma, bereavement, also bringing back, some old experiences and old trauma that's been highlighted. The particular groups in the population that have come out from this, and this is only from the organizations that are a part of this network. So yes, younger people and children are not in this as much as they probably should be. The new unemployed, furloughed, people that had a massive change to their income, loss of income, working mums that suddenly need to be also the teachers and the carers, in addition to everything else that they already do, whilst trying to keep a job, the strain on them, pregnant women and new mothers, everything to do with the pregnancy path that is very lonely these days, or men. Okay, now I need to stop looking at the messages, otherwise. I'm assuming that refers to working men as well. However, what we had what came up on the working side of things is actually more around women, probably because in the organization, probably because of the experience of the organizations having more mums needing to do the rest of the work around the house. I know it sounds really awful, but that's what came through. Again, if there's any more information that could feed into this as a particular area of need, then please send it through, and then we can amend it all. Women who suffer from abuse, or men that suffer from abuse, but we got this through a lot of the women's organizations and reporting. People with existing health or mental health issues, ongoing conditions, learning disabilities and their carer, and in addition, people with autism and their carers. A lot of strain that you've all reported even throughout this meeting. Additional information that came from you guys, actually from your report on communities of interest, was around travellers, BAME and communities of faith. Also picked up on in this meeting, and refugees and asylum seekers came in as a group with a very high need. We're talking here specifically about the needs that have arisen at the top, the mental health needs. Karen? Is Karen there? Can't see. The emerging needs that we've seen, that people have reported that are different from the year before. The first one was and I think, again, it was mentioned in this meeting at the beginning, people that need to go and see the doctor because of an ongoing condition, then being confused or just anxious about that possibility of going to an appointment with their GP, and there's lack of, so people just decide to not go or to not take their medication to go and get their prescription. There is support within all of your organizations, but what was reported is that the organizations have found that that if they don't interfere with that, then people decide to avoid contact with the system. Increased need for crisis and complex needs. A lot of that comes through your helplines or your calls. Some of you reported, some of the organization reported about how the instead of 15 minutes conversations, it becomes 45 minutes to support and to reassure people, and how there's a strain on that side of the organizations and a need for more people to man that side of things. Within that, again, it's on one group that was highlighted is the group that already has conditions and their carers, but I would say that it's also quite clear that it's across all populations groups, because everybody's been obviously affected. We do have concerns that also we could see in the report around, we call it suppressed needs, or people that we don't see, the unseen ones. So again, those a lot of people that have never come through the system are now new to the system, but we don't know necessarily how to reach them and how to engage with them, and how to get them to be more engaged with the services and not to reach a crisis point. So I think I'll stop here. I didn't see the chat. I saw only like bits of the chat popping up.
There's a couple of really helpful things in there from Young Lives Leeds and also from men's perspectives, just to make sure that we follow up with conversations with them. I mean, we were limited by the survey responses that came through, and also from we utilised everything through the Communities of Interest Network, but yeah, we're not presenting this as an entire picture as such, just that snapshot.
No, definitely not. I think the main thing when I was doing this, and Karen and I have had many conversations about this, is that there wasn't enough engagement coming through to give us the richness of the information. So please, if you have any more information that could widen this, please send it through. We also had a theme that came up, was added by the meeting we had yesterday, two themes actually. One is around younger people, and that's something that I could see as well in the Community of Interests reporting. Younger people and people that are coming out of care, as an increased need. And there's another another aspect to highlight, and it's everything around the digital exclusion that comes up really strongly. So yeah.
So yeah, that's a very quick snapshot of the information that we got through. And like Mirav said, I think a lot of it is across population groups. So we weren't necessarily able to pick out need across one group more than another, but just needs across all. So I suppose what we're really interested in doing is, you know, thinking about that a little bit more really, and working out which groups and which populations, and what we really didn't pick up on at all, which I think the wider data will with the CCG, because this just, you know, this definitely isn't only our responsibility, is some of the population stuff as well. But if we've got 5 or so minutes, I don't know how much time we have got.
I'm not sure we do. I think we've got about 22 minutes left.
Okay.
And
well,
about half an hour to get through.
So, can I add just one more thing, if we're not having any conversations here, any discussion here? It would be really, really helpful if around the whole subject of communication, if ideas like the ones that have been shared here can be shared even further, because I'm really that side came across as one of the highest reasons for the increase in anxiety, obviously, and some of the isolation. So it's about how those messages are filtered to the communities by their trusted people. So like the work that Gate has talked about here, that Charlotte talked about, etc.
Cool. Thanks, guys.
Yeah,
Sorry, Karen, did you want to add something?
I was just going to say, Owen, just that yeah, we don't have a great amount of time in terms of feedback, but I don't think that this is a one-off thing. That's the beauty of the Communities of Interest Network. This is an ongoing, regular reflection and space for us to continue to feed that stuff through. So I don't want people to think that this is just that one-off opportunity to, and it isn't. It's just us pitching in at this point with what we've heard and seen. So please do, you know, get in touch with us. And there's a couple of people that we'll contact separately as well. Thank you.
Thank you.
Sorry, someone was calling me on Teams. Yeah, so we're just going to have some kind of key pertinent issue messages. So Anna's going to talk 5 minutes on digital inclusion.
Yeah, thanks, Owen. I'll be really brief because I know we're short on time today. You should have all gotten an email from me recently about the digital inclusion work that Healthwatch is kind of leading on behalf of the PVG. The report is due out at the end of October. So we've already started having conversations with lots of you about the kind of observations you've seen from your own communities about digital exclusion, barriers, positive stories as well. So huge thanks to everyone. I think I've had a response from most people now. And also if you have already done some engagement on this subject, which I'm sure many of you have, and you just want to point me in the direction of engagement where you've already done, that's absolutely fine as well. So yeah, I'll be speaking to many of you next week and the week after, and I'll make sure you get to see a draft of what will go in the report as well about your community, so you can sign it off before it goes in the report. But yeah, that'll do me for today, and I'll let us move on to the next item.
Cool. So Pip, you talk about shielding and test and trace and all that.
And a few other updates. Yeah, brilliant. Thank you. Yeah, now let me start with the update around the sort of whole kind of COVID levels and test and trace. So as I mentioned, Victoria, there's a weekly meeting on a Thursday, and there's obviously been loads of activity. What a flurry of you know, stuff, as everybody's very aware, I'm sure, from the national press, and a huge amount of work's going into trying to make sense of that and trying to answer queries. So there is some sort of frequently asked questions that Public Health have been pulling together information about, that's been shared, that I don't think we've had a chance to send out yet because it came after the Tuesday email, but we can make sure that we send that out after the meeting. And also Sarah Erskine, who many of you will know from Public Health, is working on a specific document that is for third sector organisations, because they're really aware that while loads of organisations are doing a brilliant job at trying to translate and understand what all of the arrangements mean for them on the ground, it would be really helpful to kind of share some key principles. So as soon as we get that, we'll make sure that that comes out. I think the key thing to say about Leeds is that we're trying to, you know, the system, everybody working together are trying to manage that balance of responding to, you know, the huge urgency and, you know, making sure that we're being as safe as we can, but balancing that with people's mental health and people's social health and people's economic and, you know, all of those other layers, and also really wanting to take people with decision makers. I think there's a real you know, I think Leeds has really valued the engagement of people, and there's a real sense of trying to put people, this sort of sense of proactive, preventative and place-based approach is what kind of has stood Leeds in, you know, comparatively good stead, and trying to really work on that. And you've all absolutely been a key part of that. So Tom Reardon incidentally is working with Manchester and Liverpool because they're trying to have a sort of key cities of the north response around some of that. So there will be some further announcements coming out. And what it's going to be, well, there will be 3 levels. That the level 1 is the sort of national level. There will be a level 3, which is the real highest level, so like the northeast, and it's likely, I think, that Liverpool and Bolton, you know, some of those areas that we know are very high. And then there'll be the second level, which is places like Leeds. So there'll be a bit more information coming out about that. But I think the bottom line is, I think there's an acknowledgement now that there is a second wave, and that, you know, that needs to be dealt with. The patterns in the city are really, you know, it's right across the whole city. 2/3 of the city have got wards that are above 100. So, you know, it isn't just about particular areas, although there are still issues around young people. So yeah, hopefully some of all of that's useful. The stuff around schools and colleges, if anybody wants a bit more information about any of that. And obviously we were sharing information about some of the work that we're doing as the third sector outbreak plan. So the priority for that has been around younger people, and as Anne mentioned, we've had a couple of brilliant, thanks to Young Lives Leeds working incredibly fast to get events up and running so that we're engaging organisations working with young people. We're going to mirror that around work with old people, but it's slightly, I mean, I think the young people's work is very much around building on positives, and you know, young people are assets, and we need to celebrate and value the brilliant ways in which they are responding and being proactive. And I think it's the same for all our communities of interest, really, that's the approach that we're trying to take. But particularly, I think for older people, there is some stuff around focusing on hope and staying well, you know, and some of the points that Ali was making about, you know, people have got to survive this and live well, and we need to find ways to kind of support that. Carers, again, is another very specific issue that is really important, and really great, Rachel, kind of raising that, and particularly that getting information out to the, you know, there's 12,000 carers in the city, it's enormous. And also people from diverse communities, so people from ethnic communities is the other kind of key priority for that third sector outbreak plan, as well as supporting all of the work that all of you're doing. The really good news, incidentally, is we've appointed somebody to be a third sector outbreak coordinator. Stacey, who a number of you might know, been working in public health around peer support, Stacey Taylor. So she's been working around long-term conditions and peer support around mental health and other areas. So some of you might know her. And she's going to be starting by the end of the month, which is pretty good turnaround for somebody that we interviewed last week. So I think that's a measure of how kind of excited and up for it she is. So that'll be some additional support, which I think will be really helpful. Other things, winter, I think we've already mentioned in passing, and it's really important just to come back to the point that Iona was making about, are we clear what those messages are? Is there anything we need to do to kind of clarify that? Because that's really important. I think those are the main. Oh, testing, I put a note up on here, but so we raised this issue because there seemed to be a bit of a pullback from seeing third sector as essential frontline workers for testing, not for any Leeds reasons, but it was a West Yorkshire and Harrogate decision. And we pushed back very strongly on that. And we absolutely have support from public health colleagues in Leeds to make sure that it is extended. They're a bit anxious about, you know, as they should be with all providers, arguably, you know, that this is for key frontline workers, you know, it's not for just anybody, obviously, and we would never think that. So we just need to make sure that we've got a mechanism, and at the minute Daisy's helping to kind of manage that, but if anybody's got any thoughts about how we can make sure that gets out there. But there is this Cinder Moor, which is that kind of car park by the university that they often use for events. The testing site there has capacity, so let's use it and encourage people to kind of get that message that it's there and it's used, that it's able to be used. I think, yeah, those are the main things, I think. Oh, shielding is the other massive thing. So shielding is, because we're not having a full lockdown, we're not shielding, and that's kind of good in some ways, but what that means is potentially a bit of a loss really to people who have huge clinical you know, and other areas why they need to be really extra careful. The key message to them is, you know, don't, you know, just minimize your contacts. It's not safe. Distance isn't just about staying a foot, you know, 1.5 meters away from people. It's about minimizing the number of contacts with different people you have. So obviously that's the first thing that people can do, and, you know, the hand washing and the mask. But ultimately we've really got to look after people's mental health and well-being as well. And there's a real commitment to that, I think, across the city. So there is more work being done about that and support to that area. But again, I think that will be part of our third sector outbreak plan, to make sure that we're meeting the needs and reaching people who are shielding, because, you know, we have to look after everybody, but particularly those people. I think the focus for that will be around inner city areas, because we know the levels of poverty are much higher, and we also know that the levels of take up were much lower from the support previously available. So particularly, for example, for some Asian and Black communities, there was very low take up of support. So we need to all, you know, kind of look out for those, for people in those communities. So I think that's it, unless Daisy can think of anything that I've missed. And if any questions you have, let us know. Any other questions or things that you think we should be acting on. Certainly flu was the other thing actually that came up last time, that we've tried to share quite a bit more information as we've had it through our weekly email and on our website. But if there's more you need from us, and more that other, you know, the chances are if you want it and need it, then other organisations will too. So, you know, please do that. And we're working very closely with Voluntary Action Leeds and Healthwatch and other partners to try and make sure that we're getting you the information that you need, because you're doing such a brilliant job of using it and engaging people. And, you know, it's that hashtag never more needed, isn't it? We are never more needed than now.
Cool. According to the agenda, it's over to you again. I don't know if you covered the third sector outbreak plan that was in the agenda there, or you were gonna elaborate more on that.
You're on mute. You're on mute, Pip.
Oh, am I?
No.
Sorry, Pip.
No, not you, Pip.
Yeah. I'll put it in the chat. I'll just put some. I've just got some things in the chat, and then if anybody wants to know more, but the key things are young people, older people, and Black and Asian minority communities. We're also doing something around carers, supporting carers. But if anybody wants to know anything else, you know, just get in touch.
Is there disabilities in there, Pip, or
specifically? I suppose because sort of mental health and well-being run through all of those, but no, it isn't currently. So I'd be interested to know what you think that should be.
Yeah, I know Wendy kind of brought up quite an interesting point, is that people with long-term health conditions and physical disabilities weren't being well represented, and I guess they cover lots of different communities.
Yeah.
But it is something.
Yeah.
Look, so again, it's over to you again, and it was setting next meeting's agenda, and that was kind of, I guess I'll let you open the floor to people to kind of suggest items for the next.
I think you should. You're such a brilliant chair, Owen. I think you're on it. Keep going.
Okay. So would anyone like to kind of suggest future items for the next meeting or meetings? Oh, Wendy.
Could we look at, we know communicating with our particular communities is the main thing, communicating messages to them, and what support, so those consistent messages can come out from health, but what support is available for those communities that might be, those organisations that might be smaller and not have a lot of funding, a lot of time and resources, but really know their communities really well to help get those messages out? Because we know that it has to be in a particular format. Sometimes it's through word of mouth, face to face for particular communities. Could we look at like what could be the next steps in the support the third sector gives to getting those messages out? Or do you feel that's already covered?
Well, it is part of the plan, is to have, so a significant amount of the money is to go out in small grants to organisations. So our initial kind of focus has been to think about young people and older people, and you know, as I've said, and people from Asian and Black organisations, but I completely take on board about other groups, and I think we would be more than happy to get requests from any groups. We've also had some funding, and I know Daisy's been reminding you, and I'm really pleased that people have taken it up, that we had some funding previously that we'd allocated from our Enhancing Power of Communities for you, for being engaged in this work. You know, if there's anything that, you know, for that, again, to be small amounts of money that will help people to do that. I would be really delighted to hear if there are particular groups that you think need that, and we can make sure that we build that in. We really are genuinely committed to responding to what the need is.
That was coming mostly from the migrant and refugee groups that have from one-man bands, and we're really saying they want to have a voice, they want to be involved in forums, but it's so difficult for them.
It's so difficult to actually even be involved in forums. I mean, Annette might want to come in on that.
I think Iona was putting her hand up as well,
Sorry,
but Annette, by all means,
Just to say, I
Sorry.
was at the Leeds Migration Partnership yesterday or the day before, and they have, Lassen have got a grant for exactly that, to pay people to go on to meetings and committees. And it's a very simple form, very easy to fill in. They get £35 per hour to do this. So I think hopefully would help enormously. And we've got quite a few partners. Leeds Voices have quite a few partners of those groups as well. So, I mean, it's not much money that we can pay, but we can give them something to working specifically with these messages at this time.
I can't see Annette unless...
I'm here, but I think Iona, what Iona just said sounded really interesting, so be interesting to send the link through so we can share that information, Iona. That would be really useful. But I think in terms of there's open access at the moment to networks and forums, there are a lot going on. I think it's navigating what's the best one, you know, what's going to be the most relevant, and you know, where you can raise the issues with the most impact. So I think there's opportunities there, and people should take them up if they're offered. There is still opportunities to engage with the work streams that I mentioned earlier. So if anyone feels that they can contribute to any of those work streams, there's one around health. There's 7 of them altogether. So I think it'd just be a good opportunity to just get involved and have all the voices heard together collectively.
And also, if I could just mention, Priya and Sam are facilitating a webinar next week. So I'll make sure that we've got information, or Daisy might have a minute to just check that information and that's gone out, because I think it's a really, really important point.
Cool. Toshal?
Just really 2 things. One for PIP, maybe again for next agenda, or something that you probably already know. In terms of a lot of feedback we are getting from, so we've restarted our activities sort of slowly and in small sort of groups. So like our men's work have gone back with small groups. Our groups at different centres have slowly come back. But in terms of the message around, you know, households not mixing, sometimes staff and volunteers have been, you know, sort of saying, is this the right thing for us to do now? Whereas a lot of our public health fund commissioners are pushing us to go back to face-to-face work, which we know a lot of our people that we worked over telephone and through the lockdown would really, really like. And that's why we restarted. But it's that sort of balance, you know, is that, I don't know what the partners feel, I don't know how many of the groups, we talked about neighbourhood schemes, a lot of older people are feeling, you know, not activities to go back to. So I think something about, you know, sort of a push from what public health is saying about the messages, but then also what people really want. If people want to come out to a community centre to have that connection, because not everybody's got that connection within family or friends. Sorry, Pip. So, yeah.
I think that's a really important point, and I'm really glad you've raised that, Toshal. The other thing that has been discussed a little bit is around people in care homes and the sort of the lack of human rights almost of people, and the reluctance for practical reasons perhaps for care homes to see carers as part of the kind of care team. So yeah, no, I think that would be a really good discussion, wouldn't it, for future? So yeah, let's put that on the agenda for next time, shall we? And yeah, come back with some further thoughts on that.
Yeah, and obviously Advanet, we have an IMHRSA, independent mental health advocates, and we've got independent mental capacity advocates. So I know that there's work being done on challenging kind of like not being able to go into those settings and making sure that people's rights are upheld. So it might be that, Wendy, I don't know if we can provide a bit of an update on that so people can disseminate that information and know that there are discussions ongoing about that and advocacy ongoing around that. So we've got 2 minutes. Shaq, I know you wanted to come in and just...
Yeah, really sorry, I didn't know how to do the hands up thing. I was just picking up on those reflections there. And obviously if there's a gap in messages or the way messages are presented, I'm really sorry, I don't really have a budget for wider work, but I mean, I can certainly, if there's a gap in terms of messages and formats, I can certainly look to work with you to get messages in the appropriate format and obviously fund that element. I'm really sorry, obviously my role isn't commissioning services per se, but certainly I can commission design work and that kind of stuff.
I think the key thing, Shaq, that's come up a number of times here is about messages being generated kind of more close to the front line by organisations, you know, who can help. I think it's one thing getting the messages out, but I mean, I know you've done a lot, Shaq, and I think the thing that you did around schools this week was absolutely brilliant. But I think there's also something about supporting frontline organisations to get messages in that way in which they'll be heard, or to get them kind of created and co-produced, for example, with younger people or with older people as well, if possible. But that's a really good offer, Shaq, and we'll be back to take that up too.
Cool. So I'm not sure, maybe 30 seconds left. Did anyone have anything else they wanted to add or add to the agenda next time? No. Cool. So thanks everyone, and thanks for letting me chair, Pip and Daisy and Karen.
Thank you.
Cool. And I'll look forward to seeing you all in 2 weeks.
Thank you.
Thanks so much, Erin. Thanks everyone for coming.
Thank everyone.
Thank you, Erin. Thank you, everyone.
Bye.
Thanks everyone. Bye.